Hello, I'm Joanna Chase, Bottle Therapy founder and pain coach. My vision is to stop the epidemic of unnecessary pain, and I'm starting with you. I want to empower you to become your body's best therapist. Welcome to the 2-Minute Pain Fix series, part 2. In part 1, we left off with how scar tissue forms and holds your body hostage. This video will focus on 2 topics. Number 1, I will introduce you to the techniques used to effectively break down scar tissue, which are elbow therapy and bottle therapy. And number 2, I will explain the hierarchy of therapy and what to do with stubborn pain and injuries. Before you start following along with the 2-Minute Pain Fix treatment tutorials provided on bottletherapy.ca, please read the Bottle Therapy Safety Protocol. It can also be found at the back of my free handbook, Become Your Body's Best Therapist, which was written to better equip you with the task of hacking your body. Before I get started, I just want to say that when discussing pain, I'm not ignorant to the fact that my amazing therapy may not cure all. I know that not all pain is reversible, such as the pain my close friend lives with who was in an accident. She's tried all therapy, including bottle therapy and elbow therapy, and is now waiting for a surgery that isn't guaranteed to work. I also know that life goes beyond movement for people who are unable to move, such as my sister who lived in a wheelchair for half her life, yet she thrived at a whole different level. This message I'm sharing is for you who are seeking an alternative to status quo, possibly to prevent the need for surgery, save on therapy bills, eliminate the need for unnecessary medication, or simply because you've exhausted your therapy journey and are hoping that bottle therapy will be the one that works. Also, I need to address the not so professional term I used before we continue. Someone asked me why I say fix and not relieve or released. It's simple. When you have a problem, you fix it, right? It's the most simple way to describe how I feel right after I've treated my pain. I feel it's fixed. I know there are more technical terms, but let's just agree from now on, if you hear fixed, it means whole, restored, feeling 100% awesome. Now, did countless hours of stretching and rolling fix my pain? And all the therapy I tried work? No. Rolling, stretching, needling, shockwave therapy may relieve tension. However, you cannot stretch out or roll out your scar tissue and soft tissue damage. I've learned from my experience that a round object, such as a thumb or tools with rounded knobs, will not break down scar tissue. Remember my blender and juicer analogy from part 1? Well, this concentrate of therapy knowledge I'm sharing with you originated from when Dr. Daryl Wolf's elbow and pain-specific treatments fixed my chronic neck pain, rotator cuff, and hips. My family and I immediately became firm believers in the Wolf Deep Tissue Therapy, and I was certified in 2014 as a Wolf Deep Tissue Therapist. I've been successfully treating my family and friends and clients ever since. It's not just simply applying pressure with an elbow that works. Elbows have a pointy bone that, when used in a specific grinding motion, becomes the most effective therapy at breaking down scar tissue. The technique is like detailing your car with a toothbrush. As I continued to age and be active, my frequent injuries required ongoing therapy, and I found an elbow just wasn't enough. More specifically, I didn't always have access to a trained elbow and the frequent treatments needed to address new injuries. I was motivated to solve this problem, but not just for me. Many of my clients were in the same boat, wishing there was a way to relieve their pain while also saving time and money on their therapy appointments. So I got creative with the ancient art of using an object for self-therapy and applied this knowledge of effective scar tissue breakdown to my experimentation process. After spending endless hours in trial and error, tweaking the technique, learning the do's and don'ts and safety protocol, along with how to troubleshoot to get results, and fast, I finally perfected the art of a new therapy technique I call bottle therapy. The process revealed that by using a perfectly shaped glass bottle, the same way I would use my elbow along with the pain-specific treatment routines, I could achieve the same pain relief as I did with elbow therapy a majority of the time. How does it work? The Bottle Therapy Pain Crusher was designed with a very specific size and shape that is easy to hold. The right angled edge at the bottom and at the top. It effectively grinds down scar tissue at the superficial and deep layers of your soft tissue, along with releasing adhesions in the connective tissue. This is why bottle therapy clients are experiencing quick tension and inflammation relief, along with releasing nerves, blood vessels, and lymph nodes from being compressed. Now let's take a look at the hierarchy of therapy. The hierarchy of therapy defines what will be the best therapy to target scar tissue breakdown and is a guide for customizing your therapy plan. Elbow therapy will always be the most effective therapy for addressing chronic and acute painful or aggravating conditions from head to toe on areas you can and cannot reach. However, elbows are not always accessible for daily treatments. You will hear me say, if you can reach it, you can fix it. Bottle therapy for areas you can reach is the next best thing to elbow therapy, as it will work 90% of the time simply because of unlimited access to self-therapy. There may come a time, though, the bottling will not work for you, as my clients and I have experienced. This is wisdom that I will explain when we discuss the rule it out method. But for now, it is important to understand there are limitations to bottle therapy when it comes to stubborn scar tissue. This is why I provide virtual coaching for those who want a family member or friend to help, as the elbow therapy technique can quickly be mastered through video chat training. Children as young as 7 years old have become pro therapists and treat their parents for neck, back, and hip pain. My own son and husband are excellent at elbow therapy. The additional therapy that supports your recovery, maintenance, and prevention is proper rolling and stretching, especially when daily bottling or elbowing is no longer needed. The daily habit of stretching and rolling will aid in tension release, flexibility, and range of motion. Once you've completed the training provided by Bottle Therapy for specific conditions, no therapist will be able to compete with the results you get. Not even me. It's not that other therapists aren't good. It's just that when relieving your pain the fastest way possible, the formula requires multiple daily treatments. And these can be done in less time than it takes for you to get ready and get into your car just to drive to a therapy appointment, which would be a complete waste of time and money if your bottle therapy or elbow therapy treatments work.
So now being able to find that scar tissue myself and break it up is done, and I can do it on my own, so it's amazing.
So getting back to becoming your body's best therapist, let me ask you a question. Are you better at brushing your teeth than your dental hygienist? Sure you are. Just like plaque on your teeth releases when you brush your teeth morning and night, something your dental hygienist can't do, even if they have a better technique, your body's dysfunctional tissue releases when you treat it 2 to 3 times a day, even if you're awkward with your technique or not as skilled as I am. And here's why. When you follow the formula 235, you disrupt the pain cycle and stop inflammation often immediately.
It works pretty much instantaneously.
The formula is 2-minute treatments for each specific area, 3 times each day, for 5 days in a row. Pausing the pain cycle repetitively throughout the day allows the body temporary relief from the pain just long enough for nerves to release the muscle from the constant tension it's growing accustomed to. You are programming your muscle memory to remember long, relaxed, inflammation-free soft tissue. What's the point of offering you the formula to fix your body when you don't have the strategies in place to implement new therapy habits? Good intentions and goals to live everyday pain-free will not always be enough. Our human tendency leans more to being kind of lazy when it comes to self-care. Here are some strategies avid bottlers have implemented to develop this habit of self-therapy. Starting with strategy number 1. Stick a Formula 235 Post-it note on your fridge or bathroom mirror to keep track of your treatments. Your plan needs to be in your face and visible. This PDF is found at the back of the Becoming Your Body's Best Therapist Handbook. Number 2, place your bottle therapy tools front row and center. Have one in the kitchen, by your coffee maker, by your bed, in your shower, or in your gym bag. Number 3, set up an exercise mat in your living room or bedroom with a bottle beside it and a hand weight for rolling or your H2O roller. Number 4, make a plan to gradually establish these therapy habits to ensure they stick and you achieve the results you want. For example, in week 1, you may start with bottling only 1 time each day. Week 2, bump it up to 2 times each day. And then week 3, you're receiving all the benefits of the Formula 2-3-5 by doing a 2-minute pain fix 3 times each day. You may be experiencing multiple injuries and conditions, so create a pain priority list and work through each condition using Formula 2-3-5. You will not have to bottle daily once you feel 100%. You will bottle for maintenance and prevention as needed. Also, as discussed in the hierarchy of therapy, there may be conditions that require bottle therapy to be replaced by elbow therapy. So please note that when I'm referring to the act of bottling, your customized therapy plan may say elbowing. This concludes part 2 of the 2-Minute Pain Fix series. I introduced you to the elbow therapy and bottle therapy techniques and how the hierarchy of therapy works, along with a brief description of the Formula 2-3-5. In part 3, I will introduce you to your new best friends for life, the most effective therapy tools I have used that make living pain-free extremely convenient and addictive. Here are some avid bottlers and elbow therapy experts who have learned that despite this unconventional therapy, they can quickly relieve their pain anywhere at any time.
When I bottle, I feel immediate release. If I'm skiing on a hard day, my knees are really sore, I go home and I do bottle therapy. The next day I wake up and I don't have to really take glucosamine anymore.
Because I have such an active lifestyle, I use bottle therapy daily, head to toe.
I'm glad I don't have to go to my chiropractor anymore and the therapists anymore because I can bottle myself. I'm my best therapist.
I'm Melinda and I love bottling. It's part of my daily routine.
With the 2-Minute Pain Fix, I get a chance to take care of myself for only 2 minutes, and it's easy to fit into every time of my day whenever I need to make sure that I keep active and healthy.
I love the education that bottle therapy provides. It's easy to follow, very self-explanatory, teaches me my bottling routine for my specific pain.
I'm Joanna Chase, and I hope you join me in living pain-free every day.